Hello, my name is Tom Stiles with Identification Systems Group, or ISG. I'm pleased to speak to you today about challenges facing the healthcare market in terms of patient identification, and about how an amazing solution offered by ISG called Patient OneCard can help solve those challenges and create an amazing return on investment. So, as most of you know, many of the identification challenges in healthcare today are positively identifying patients during registration, reducing or eliminating costly duplicate medical records, increasing the speed during registration while protecting sensitive patient identification. You need to implement electronic health records, reduce fraud, and also improve marketing and brand recognition. So there are a host of things to think about. Today, the issues are that most duplicate records are created during registration. The causes include misspelling, missing data, use of nicknames, transpositions, common names, language barriers, ethnic groups, and more. Common names, as an example, Thomas Smith. It could be in your system as Thomas Smith, Thomas E. Smith, Tom, Tommy, Thomas Jr., and so on. These can be exaggerated even further when the patient has language or ethnic barriers that make communications more difficult. And as most industry experts agree, these issues result in duplicate and even triplicate medical records. But cleaner records are imperative as industry moves forward with a national health record or regional health information organization and implementation of electronic health records. If you're going to have an electronic database, it's obvious that you need it to be clean, accurate, and not duplicated. So with the transition to electronic records, they're concerned about linking the correct record to the correct patient. So proper identification becomes even more important as the health information exchanges emerge around the country. The idea of these regional networks, as you know, is to enable properly authorized physicians to find medical information about a patient without jumping through multiple steps as they do now. However, it's these large integrated networks where the identification problem is amplified. So a hospital may have 15 to 20 Tom Smiths, but when you expand that to a city, county, or a state, the number can be hundreds or even thousands. So the pot of gold is that everyone gets electronic medical records, but there's an issue that you need to make sure that everyone is properly identified accurately and without duplicates. So we've been talking about the issues of positive identification, but what about the justification? So there's a lot of information out there from industry experts that talk about the problem of duplicate medical records and the cost to detect and correct those. Industry estimates are that there are 5 to 15% duplicate medical records in an average database of 500,000. The direct cost to detect and correct these duplicate medical records is estimated at $20 per duplicate and on up to several $100s. So the cost of duplications can quickly escalate into a lot of money when multiple systems are involved and the personnel resources are considered. As an example, consider a database of 500,000 records and a duplicate rate of 10%. At the industry average cost of $20 each, the total cost of duplicate records is $1 million. Studies estimate also that 50 to 90% of claim denials could be prevented by securing accurate patient identification at registration. So enter Medical Group Management Association, or the MGMA. The MGMA launched last year a program called Project Swipe IT, or Swipe It. And MGMA understands the waste that results from non-standard ID cards. And they're promoting an industry standard ID card that utilizes the WIDI Health Identification Card Specifications. WIDI stands for Work Group for Electronic Data Interchange and is part of ANSI, the American National Standards Institute. So if you go to swipeit.org, you'll see that MGMA is leading a healthcare industry-wide initiative to advance the adoption of standardized patient identification cards that contain this WIDI-compliant machine-readable data. And the MGMA is taking the lead to prevent as much as what they estimate $2.2 billion in wasted time each year as a result of the non-standardized cards. So now you've issued patient identification cards to a portion of your patient population. As an example, here's the patient identification card. So what are you going to do? Well, up until now it's been a challenge really to find an affordable reader that will do what you need to do, and that is fill in the multiple screens that you have that you need to enter patient information into. So we want to show you how we can solve that. Consider this example. A patient, Nicole Townsend, arrives at registration. Currently, you would enter information into your search screen, hit enter, and it would search the database and recall Nicole's record, or it might not recall the record if you typed in something different, or it might recall multiple Nicole Townsends that you'll have to scroll through. So that takes time. So on the screen here, you'll see your healthcare system screen demo. So keep in mind that you will be looking at your exact hospital information system or practice management system screens, not any software from us or from ISG. Everything's going to run in the background. We're simply filling in the screens for you automatically and accurately. So Nicole arrives and presents her card to registration. The card is quickly read in our reader, and you'll see within 1 second Nicole's record popped up. That's amazing. For the next example, a patient comes in, Thomas Stiles. Now, Thomas has not been issued a patient identification card, so how are you going to utilize our reader for that? Well, you'll ask for the driver's license, as you normally do, for proof of identity, and then you'll take the driver's license and actually scan it in your search screen. So it can fill in information from the driver's license, like last name, first name, middle initial, date of birth, and you should be able to recall the record quickly. In this case, Thomas is not in the database. And I'll show you by scanning the driver's license. Your search screen is going to not return a record for Thomas. And so you're going to have to enroll Thomas into the database as a new record. So you'd have to type it all in, and that could be prone to mistakes, and of course takes time. But with our intelligent reader, we simply hit a hotkey and it fills it in automatically. So your health information system will automatically assign a medical record number, and then you'll just simply print a card. So within 5 seconds, a new patient identification card will be printed for Tom Stiles, and you'll be able to present that to him at that time, along with the instructions and the value of carrying that card. So there you have Tom Stiles. A review of the benefits of what we've just shown you is that you've issued a patient identification card that has a lot of marketing power. It's the billboard in the billfold, the constant daily reminder of your facility to your patients. The card is seen as valuable and gives your facility a high-tech image. Also, it increases patient satisfaction due to speed, efficiency, and privacy of the registration process. And for those patients who do not yet have a card, you can scan a driver's license and or the insurance card to receive the same benefits. So the bottom line is you have a huge return on investment based on reducing duplicate medical records, saving time, increasing marketing and brand recognition, plus additional savings that you may see from reduced fraud due to proper identification. Your time.